Hi, it's Jeannie, your pharmacist and owner here at Revival Pharms. And wow, what a week! And it's only Wednesday. I am so excited to chime in on this whole Tylenol thing and give you some information that you're probably not hearing anywhere else because everybody's focused on whether the research is legit or not. But we're going to talk about a different aspect of acetaminophen that's been around for a long time. These studies, I think, were done back in 2018. And what Tylenol as a drug, the side effects that many don't even know. So just a little history on Tylenol. It's the brand name for acetaminophen. It is a common painkiller used over the counter and in combination products prescription wise. So you'll see them with the opioid combinations in the past, things like Vicodin and Percocet, Norco 5325. Many people use it daily for pain if they've overdone it outside. We even use it in children, obviously in pregnant women. It comes in all dosage forms from a liquid to capsules, tablets, suppositories. You can pretty much get it in any way that you're needing it that's convenient for you. But acetaminophen, like all common pain relievers and drugs, they all have side effects. It just doesn't matter what it is. They all carry side effects. If they can elicit a response, they can have a side effect. Acetaminophen overdose is one of the most common poisonings worldwide. It is the leading cause of liver failure in the United States, and it's responsible for roughly 56,000 emergency room visits. So you need to think about that. An emergency room visit is going to probably cost you about $5,000. I'm not sure you can get out of the ER for less than that. And I always like to think of things from a cost basis. So just the ER room visits from Tylenol is roughly about $280 million. So wow, if we could not cause all those emergency room visits, that would be amazing and cut down healthcare costs because we're all paying for that. And Tylenol also accounts for 2,600 hospitalizations each year in the United States, resulting in around 500 deaths per year. So in 2009, and I remember this happening when I was working the bench in retail pharmacy, FDA started mandating that products containing acetaminophen, they had to have specific labeling for liver damage. And then that's where Vicodin 500, which is a combination of an opioid with Tylenol, got changed. And then it went down to Norco 325. And so you only had 325 milligrams of acetaminophen versus the 500 milligrams. So you saw a big shift when they came down with the labeling. So they've known about all this liver issue for quite a long time, but it still has just stayed on the market for a pain reliever. So other serious side effects that we're going to talk about today. And I think they're serious because if it's changing people's emotional state without them knowing, that is, to me, a severe side effect. So a study that was done on acetaminophen was done at Ohio State University. And what they did was they conducted 2 experiments testing whether acetaminophen blunted a person's evaluation and their emotional reaction to negative and positive stimuli, meaning just they did pictures. People who took a Tylenol, the acetaminophen, evaluated unpleasant stimuli less negatively and pleasant stimuli less positively compared to the placebo. So what that meant is they were shown an image and they did not elicit the same response as somebody who didn't take Tylenol. So it could have been a happy picture, but they didn't get near as happy. Or it could have been a very sad picture, and they didn't even react as sad as a normal person to this picture. So the findings suggest that acetaminophen has a blunting effect on an individual's evaluation and emotional processing for negative and positive responses. Previous research has actually shown the same thing, saying that it not only affects physical pain, but it also has an effect on psychological pain. But then again, people that take it, they don't even realize that they're having a difference. And that's where it's very deceptive, because if you're taking a drug and you don't even know what it's doing to you, that's really alarming. And so this researcher, this Jeffrey Durso, who was the lead author of this study, he just says that Tylenol is not just a pain reliever. It can be seen as an all-purpose emotion reliever. And, that's really alarming, because I'm not sure people are taking Tylenol for an emotional reliever. So anyway, I find that very alarming and very deceptive, because people have no idea. And I'm sure you're not going to see that on the labeling of Tylenol saying that you should be concerned about a change in your emotional status. So they took this research and they repeated the same thing, what I just told you, and it showed the same results on the second time, because you never want to look at a study just one time, because it could be an outlier. So they actually duplicated the study and got the same response on the second study as well. So very interesting. And the thing that I find very similar with this study to a much lesser degree is the same thing that you see with the SSRIs, all the antidepressants, things like Celexa, Prozac, Zoloft. If you talk to people that have been on those drugs, and I've worked with people to get them off and they have been successful, they say their emotions were completely dampened, that they even go so far to say that a family member could have been killed and they wouldn't have even cared. So that just goes to show they're not going to elicit an emotional response to anything. And it's very similar to what you're seeing here with Tylenol, but just to a much lesser degree. And people need to be aware of that. It really needs to be informed consent, and you need to know the effects that these drugs are going to have on your body. And I want to end with, this is the very reason why Revival Pharms was started. When I saw a lot of these ingredients and actually drugs that I thought were good were actually not really good at all. And after doing a lot of research, CBD and hemp, actually CBD, cannabis, hemp, things with low THC, the research is out there and they're very beneficial for pain. And if we can be honest about what they can do, then I think it's a better alternative than using this type of Tylenol, especially if that's linked to autism and other damaging things. And liver failure is huge. So CBD, our full spectrum CBD oil that we grow right here on our farm, and our topical pain reliever, we feel like those are an excellent solution to this problem that we have just found out with Tylenol. And we stand by those products and we believe in them. And this just goes to show that what we started this company for is actually really coming to fruition because of the news that just came out this week on Tylenol. So it gives you a different perspective. I hope you learned something, and thanks for watching.